Hey everyone, Shauna here again. Just following up with more level up tips from last time. Thank you all for your comments. So let's just jump right into it. Last time we talked about decision making frameworks, especially in really dynamic scenarios, operational environments where things are fast paced, changing. You need to be able to make a decision on the fly. So I just want to build on that this time and talk about emergency decision making. So just one more critical step up. And I want to talk about two environments that I work in a lot. So, aviation and medicine. And basically, it's knowing your decision making framework inside out and then just falling back to that and using your clinical judgment. So in emergency medicine, we say ABCs. In aviation, we say aviate, navigate, communicate. And I don't mean that you just need to know those words and then have no follow up. So basically, what these mean is that there's always a framework to guide you when things are hitting the fan. And so in medicine, I've been in some trauma situations where things are a mess. Maybe there's been a high speed motor vehicle collision, rollover in an icy road. There's multiple things going on with the patient. There's multiple deformed limbs. They're screaming, and it's easy to go attend to the thing that seems most dramatic, like maybe a bone is poking out of the skin or like an arm is clearly deformed. And it's easy to get sucked into that fixation bias. And I've literally walked into these scenarios and then it's sort of like, where do you start first? There's so much going on. And then you just take that split second, you take a deep breath, just ground yourself. And then have literally said to myself, ABCs, like, yeah, there can be a broken bone. That's not going to kill the patient. It's going to be a mass hemorrhage, an airway problem, a breathing problem, a circulation problem, in that order. And then we get to the broken bone. And in reality, multiple things are happening at once. You have a team behind you. You have the nurses. You have people helping, put monitors on the patient, get lines in. But it just helps ground yourself. And it's the same thing with aviation. So when you are in a critical scenario, you may want to call for help first, but the first thing you need to do is get yourself out of a bad situation. You need to fly the plane. So we say aviate, navigate, communicate. We say get yourself out of that situation, stabilize the plane, figure out where you're going, and then call for help, because that is the order for survival for yourself. And in medicine, ABC is the order of survival for the patient. So the other part of that, there's two more things I want to talk about really quickly, is it's not enough to just know those words. You have to drill them. You have to know what exactly each step entails and what you're going to do in the most current situation, as well as if things decline further. And so I know we hear a lot about just-in-time training. I do a lot of work in that space, but I can't underscore this enough. This just-in-time training is meant to be refresher training. Like, you cannot go into a code situation never having studied what the code pathway is before. You should never have piloted a plane without ever having gone through your emergency protocols. You need to have drilled those, because when there are so many factors going on, you need to be able to do this stuff in your sleep. You need to be able to get your lines in, stabilize your patient, get fluids in, get blood products in. You need to know what every step of your critical pathway is. So just-in-time training is there as a kind of reminder, but you need to drill this stuff. So that's the first thing I wanted to tack on there. And then the second thing is, in addition to your critical pathways, whatever your framework is, ABC, ANC, call for help. Always, always, always. If you have the ability to call for help, once you have kind of done the mission critical life-saving stuff first, phone a friend. In medicine, I do this all the time. Even if I'm the only physician working in a town of 700, I always have the ability to remotely call a consultant and say, hey, this is what I've done. What else would you do to optimize? And sometimes there's nothing. Sometimes I've done everything, and that reassurance is great. It's really helpful when I have the pediatric patients are the scariest. The PICU, the NICU, the pediatric ICU, the neonatal ICU, they're always so lovely, because they're like, you're doing a great job. And, you'll be at the other end of the line saying, I don't think we are. But it's always really nice to have that external support. Same thing with, aviation and space. Like if you need external support, calling on your team, calling on extra hands is really critical. So, that was a really surface level discussion. I'm trying to keep these short so they're, digestible, but maybe someday I'll go into longer format discussions. But yeah, just want to talk about emergency decision-making frameworks as I build on from last time. Would love to hear your thoughts. Would love to hear about what else you want to hear about. So that's all I got for this week. We'll see you next week. Hopefully that helps you level up. Shauna out.